Arizona's news headquarters at 200 EVB. Arizona Nightly News begins now.
And good evening. Tonight, cell phones and cancer. It's long been questioned if there was a possible link, and now a respected institution is confirming a link between cell phone use and cancer.
The World Health Organization now calls cell phones a possible carcinogen in the same category as lead, engine exhaust, and the pesticide DDT. 5 billion people use cell phones worldwide, and the devices have become more and more popular in the last decade.
All right, so what do you do with this new information? We've got a doctor standing by to explain the findings. A technical expert will be here to break down your options. And
Lisette Martinez is digging deeper into one of the most alarming findings of the study, how children are more vulnerable to the effects of cell phones. Lisette?
Trem, I spoke with many parents this morning who were frankly alarmed by the findings. Others seemed more skeptical of the data, but doctors say we all need to pay attention. For the Kelly girls, cell phones are their lives. They've had them since the 6th grade and use them often. Okay, girls, so have any of you heard about radiation and the possible use of cell phones and linking them to cancer? I mean, what do you have to say about that?
Well, I gotta say that I think that you probably get more radiation from taking your dental x-rays than from your cell phone.
But according to the World Health Organization, heavy cell phone users have a 40% higher risk of developing certain brain cancers, and research shows children are more vulnerable.
It's not a matter of whether you're exposed or not, it's really cumulative.
Dr. Adelson says the microwave radiation emitted by cell phones can penetrate a child's brain more so than an adult because their skulls are thinner and their tissue more susceptible to damage.
A microwave oven, you basically are utilizing microwave radiation in order to cook the tissue from the inside out. And so exposure with a phone, for example, near your ear, potentially is exposing those areas to that same type of radiation.
I say everyone's going to die for a reason.
Despite the data, Clarissa and her husband believe their children are more at risk of being attacked by a stranger than getting cancer from their mobile phones. So for now, the little gadgets will continue to be a major part of the Kelly's household.
I text them, whenever they get somewhere, they say here, you know, and then when they get from one spot to the other, that makes me feel good, and it's worth the risk.
Now, while Dr. Adelson says don't panic, he does hope this begins a process of making cell phones much safer. In the Information Center, Lisette Martinez, 12 News.
Lisette, thank you. The FCC does regulate how much radiation a phone can emit. Today, a lobbying group for the cell phone industry released a statement emphasizing the fact that the World Health Organization came to its findings based on previous research, not a new study. The CTIA also wants you to notice that using cell phones does not mean you will get cancer.
And Tram, that's why I'm glad we have Dr. Scott Tannehill here from Arizona Radiation Oncology Specialists to help make some sense of this. Should we really be worried? And cell phones, doctor, such a big part of our lives, not only here in the States, but really around the world. So hearing this information today, how concerned should we be? And if it were you, would you put down your cell phone?
I think it's important to point out that the WHO's comment was that cell phone use is possibly linked to tumors of the brain. I am not going to change my phone use habits. I don't think anybody needs to throw their phone in the trash. So I don't think that any scientist is going to look at the available data and say that this is a definitive statement. What the WHO has done with this statement is to simply ask that we pay more attention to it in the years to come.
All right, so if you can, and you work with radiation in your profession, put this in perspective for us. How potentially dangerous could this be?
Again, assuming that the microwave radiation emitted by a phone is even causing cancer.
Well, let me. Do you believe it?
I don't.
Okay.
I don't actually.
All right. So then let's go on the assumption though that the World Health Organization is onto something.
Right. In the off chance that this is actually a true causative agent for cancer, the best way to reduce your risk is to minimize your contact with the source of radiation. So removing it further from your body. Our phrase in radiation oncology is distance, time, and shielding. Limit the amount of time, move it further away from your body, and if possible, have some source of shielding. So the use of a simple hands-free headset or as an intermediate measure, a Bluetooth earbud would be a very good way of reducing your exposure.
All right, we put this out on our Facebook page today, and one of our viewers writes in about Bluetooths. That's actually transmitting, and it's right in your ear. Should that be a cause of concern?
If if the cell phones can cause cancer, the Bluetooth is emitting radiation at a much weaker signal. It's much lower energy. So it would be not quite as good as a hands-free set in reducing your exposure.
All right, and Tram, as we toss it back to you, I just want to point out the doctor said earlier something very interesting, and that is more people will probably die from driving while using the phone as opposed to the radiation from the phone, correct?
Oh, almost without a doubt. We have scientific proof. We have patients' testimonies that they were in the car accident because they were distracted while driving with a phone up against their ear. We don't have any hard proof, actually, that cell phone use causes brain tumors. It's a theory based on a few preliminary studies, and even the WHO admits those studies are flawed and stops short of saying this is conclusive evidence.
All right, Dr. Tannehill, good to see you. Thank you for coming down.
Thank you.
All right, Tram.
All right, excellent point, just keeping it in perspective. You've just heard about the medical concerns, and now we want to talk about basically how to minimize all that exposure that the doctor was just talking about. Ken Moskowitz from Data Doctors joins us, and first off, let's talk about kind of the 101 of just the basics of what happens in the phone.
Sure. Basically, this is a microwave device, just like the microwave you cook with. It's the same frequency. The hardest part of this phone, or the worst time your exposure occurs, is when you're driving. Because when it's hopping from tower to tower and it's reaching for a signal is when your maximum exposure occurs. So I don't know many of us who talk with a phone about a foot away from our face. Everyone's right here when they're driving. So to minimize the exposure, you can go to a Bluetooth headset. They're minimized. It's not eliminating. Or you can go really old school and get an earpiece. It's just an old school radio earpiece.
Exactly, and a lot of cars these days, you know, the Bluetooth is inside the car. It's mounted from within, so that's another limited way to, you know, reduce your exposure.
Right, you push the button, you start talking, the phone is not up to your ear, and you're able to have a conversation. I wouldn't recommend using your phone like this on speaker in public.
Yeah, no kidding, very annoying. Very quickly, would you change your habits after the study?
Habits aren't changing today.
Okay, thank you so much, Ken. Mark, back to you.
All right, Tram, thanks a lot. So how can you find out how much radiation your phone puts out? CNET.com. CNET.com is a tech website that has a list of phones that emit the most and the least radiation. Samsung makes the top 3 phones with the lowest amount of radiation. The Samsung Blue Earth, the Infuse 4G, and the Samsung Acclaim all put out low amounts of radiation. Highest radiation, Motorola Bravo emits the most, followed by the Motorola Droid 2 Global and the Sony Ericsson Satio. You can check out the radiation of your cell phone. Just go to 12news.azcentral.com. Click links on 12. You can also join the conversation anytime on our Facebook page.